Hi, good morning, everyone. 13th of September. We are live yet for another very important session and a very important topic and a very important speaker, Dr. Arundhati Dasgupta. It is my privilege to introduce her. Dr. Dasgupta is a director and consultant endocrinologist at Rudraksh Superspeciality Care, Siliguri, West Bengal. She holds an MD in medicine and DM in endocrinology. She's also a fellow from American College of Endocrinology. Over the years, she has been recognized by prestigious awards, including A.V. Gandhi Award for Best Thesis, Diabetes Awareness Initiative Award, the RSSDI Innovative Award, and the Icon of Endocrinology Award in 2024. She has coordinated multiple national, regional training programs, delivered numerous presentations at national and international platforms with several publications in her name. Today, she will be talking about gut-brain axis in obesity, highlight the criteria interplay between the gut and the brain in regulating obesity and metabolic health. Please welcome us to join. In case anybody would like to join, I would like to open the session. People can join this session by Zoom 818-8591-1572. I repeat, 818-8591-1572 and ask questions in the chat box. Please, Dr. Arundhati.
Thank you so much. And it's a great pleasure to be here and to discuss this very important topic, as you said, because with time, we've gradually understood how very important access is. Please allow me to share my slides.
It is.
Yeah, just 1 second. All right, yeah. So good morning again. We're talking about the gut-brain obesity axis. And as I was just saying, with the passage of time, we've understood how obesity is so much more than calories in and calories out. Today, as we understand obesity, it's a complete, a complex axis involving so many organs of our body, the brain, and of course, as we understand more about the brain, we have come to understand how various factors have a role to play in the various areas of the brain that kind of determine how a person is going to eat, how a person is going to respond to what he eats, and in this connection, the gut has been found to have a very important role to play. And that is what we'll try to understand now in the next few minutes. So this is a very interesting book. As I was preparing the slides for this talk, I came across this book which says that your gut and your brain talk more than what most couples do. And the author says in a coordinated way, what he is trying to imply is that most couples do not talk in a coordinated way or not, we do not know. But yes, indeed, this is a mind-gut coordination, which has a very strong role to play in the metabolism and, the way the body is responding to a lot of factors. And as we understand this, beyond the energy intake and the energy expenditure, we have understood that today we have the hedonic input understood, which is about the palatability or the pleasure of eating. And then there is the environment, which has, of course, the lifestyle and the psychosocial factors put in. And both have a role to play in various organs of our body, the adipose tissue, the pancreas, the gut. It has a role to play in the entire genetics. And of course, a lot of medications would also have a role to play in this entire axis. Now, if we look at the mind-gut connection, the mind is regulated by physiological processes. There are so many integrated gastrointestinal responses to the food intake. And the gut microbiota, the nutrient acquisition, the energy regulation being strongly influenced by what is there in the gut in terms of microbiota, and of course the hormones there, and all of this contributing to the pathways of the alteration of the symbiosis, you could say, and leading to a dysbiotic environment, which can lead to obesity. Now, as we understand about the various areas of the brain that control the eating behavior, the appetite, we know that the weight is basically determined by a unique three-layered appetite system. Now, if we look at the various areas of the brain, we have the homeostatic eating, that is the eating that is controlled by hunger. And that is again controlled by a number of endocrine feedback signals. So we have hormones like GLP-1, the PYY, the amylin, insulin, leptin, and others, which have a role in the increasing of satiety. And then we have ghrelin, which is again increasing the hunger. And these are the hormones which are secreted by various parts of the gut and which can have an effect on this particular area, the homeostatic eating area of the brain. And then again, we have the hedonic eating, which is basically about eating for pleasure. So you like something, you like to eat something, and it's not entirely, you who is regulating it, it's your hedonic part of the brain. So there will be somebody, who will be very happy eating salads, while the other person who cannot think of touching the salad who will rush toward the dessert counter at the first instance. So it's not entirely his or her prerogative to choose that. It's also this particular area of the brain's reward system, which controls this. So this eating for pleasure is basically controlled by the dopaminergic system, by the cannabinoid receptors, the opioid receptors, which can control the wanting, the motivation, the liking, and the pleasure associated with food. And then we have the executive function, that the homeostatic and the hedonic put together is telling you whether you should be eating or not, or what you should be eating. And then is the executive function, which is having a strong role to play in deciding the self-regulatory process. You might want to have the dessert, but if your executive function is controlling you enough to tell you that no, you shouldn't be, or you shouldn't be eating that junk food or the high calorie food, you might be able to control that. Now, that executive function is again controlled by a number of hormones and a number of secretions that are partly controlled by the gut, and that is what we'll try to understand now. So it's basically about the thoughts, the feelings, and the behavior, which kind of control the coordination between all these three areas, and ultimately determine what are we eating, when are we eating, how much are we eating. So when we talk about the gut-brain axis, it's basically a complex bidirectional pathway, which is essential for the metabolic homeostasis. So the gut is basically interacting with the CNS to transfer the information on the nutritional status through a number of mechanisms. And one of the mechanisms is the EEC, or the enteroendocrine cells, which has a connection with the vagus system and the enteric system, and is thereby conferring information about what is happening in the gut to the brain via various pathways. So if we talk about the enteroendocrine system, there are around 15 types of enteroendocrine system cells which produce more than 20 hormones, and these are like serotonin, ghrelin, cholecystokinin, peptide YY, and these hormones have roles to play in various processes, including the gut motility, the food intake, the insulin secretion. And these particular cells are basically respondent to the nutrient and the mechanical stimuli. That is, the environment in the gut basically decides what kind of cells these EECs are going to, what kind of hormones these EECs are going to secrete. And once they have secreted these hormones, they would mediate their effect on the secretion, the gut motility, through the various vagal efferent or the ENS system, or to the release into the bloodstream of these various hormones. Now, if we look at the particular gut hormones, and we're talking about ghrelin, we're talking about PYY, the cholecystokinin, the GLP-1, of course, the pancreatic polypeptide, the leptin. So we know that today they have interactive kind of roles, and they will have roles to play in the various areas of the brain, particularly the areas of the brain that are dealing with the orexogenic and the anorexogenic areas. So the POMC and the NPY and AGRP area, which are the anorexogenic and the orexogenic centers respectively, and they will kind of send across messages to these various areas, which will in turn have roles to play through secretion of the second order neurons. So this is a very nice picture which kind of tells us in a very short way which hormone is acting in which area and what is it kind of doing. So we can see there the satiety centers, the hunger center, the leptin, GLP-1, PYY directly acting through the POMC and indirectly through the NPY, and they'll have a role to play in the MC4R area of the hypothalamus and bring about the homeostasis homeostatic regulation of feeding, that is, this satiety, and this is what is being harnessed when you're looking at the newer molecules that are coming across. The role on satiety, the role on hunger is basically controlled by these gut hormones, and you can see there the interactive pathways that has been shown in this particular figure. The vagus nerve also has a very strong role to play about carrying across these impulses, also directly or indirectly. And this is where it receives information about the enteral content, and it carries it to the nucleus tractus solitarius. And there onwards, it goes on to the hypothalamus, and again to the various areas, the POMC and the NPY and the other areas, and thereby the regulation of appetite, food intake, and energy balance again. So partly this activation of the vagus nerve is dependent on the secretion of the chemical signals like PYY or GLP-1 and CCK by the enteroendocrine cells that we spoke about. Then is, of course, the role of the gut microbiota. Now, we have understood over the last few years, and we are, increasingly understanding more and more about the gut microbiota and the very essential role that they have to play in the various physiological mechanisms of our body. And when we take a look at what basically defines the gut microbiota, it has been defined as the totality of the microorganisms, the bacteria, viruses, protozoa, fungi, and their collective genetic material that is present in the GIT. Now, the studies about the microbiota have started way back in 1940, and that was when the first germ-free rats were used to investigate the role of microbiomes. And fast forward, we come on to 2007. That is when we started understanding about the role of these gut microbiomes in the metabolic disorders. And we can see as we move on to 2008 and 2010, there has been a rapid increase in the publications in the field of gut microbiota and the association with the metabolic disorders or the dysbiotic environment that is caused in terms of obesity, in terms of type 2 diabetes and other metabolic disorders. So when we say dysbiosis, what exactly do we mean? We mean that the normal gut microbiota would have a certain kind of, microorganisms in the body that is normal. You can see them mostly predominantly by bifidobacteria and lactobacillus. Of course, it's an oversimplification, but just for us to understand. And as we move forward to a dysbiotic environment, which can be caused by a number of things, we can see that the entire environment is kind of changed, and we have other microorganisms coming in. You can see Streptococcus, E. coli, Proteus, Klebsiella, and all of this, and the gut microbiota environment being changed from what was essentially lactobacilli and the bifidobacteria. Now we're getting Yersinia and Staphylococcus, and then fungal infections. So thereby causing a complete dysregulation of the normal gut microbiota environment. So normally you could say in a simplified manner, if you have a normal gut, the microbiota would be predominantly Firmicutes or bacteroids and acidobacteria. And if you have the microbiota in obesity, you can understand that there's a major increase in the Firmicutes, a reduction in the bacteroids, a higher level of acinobacteria, and lower proportion of microbia. So a relative decrease in the abundance of bacteroids together with a relative increase in the Firmicutes is kind of a characteristic of the obesogenic microbiota environment. And there are a lot of things that basically are responsible for this alteration in the gut microbiota. We could talk about the lipoprotein lipase or the small chain fatty acids, the increase in the fat intake, increasing lipogenesis, the gut endocannabinoid system getting affected, increasing its action, and of course a lot of factors which have an effect on the gut permeability and the increase in the lipoproteins, lipase and lipopolysaccharides. All of this kind of alter the gut microbiota. They have direct roles in obesity. They also have an indirect role via the gut microbiota. So how do these microbiota affect the axis? Now, they act through a number of pathways. They could have the alteration of the neurotransmission, the dopaminergic, the serotonergic activation, then the immune pathways, the enteric nervous system, the activation of the vagus nerves, and also via the various secretions of the gut hormones, the peptides, and the microbiota-derived products. When we talk about gut permeability, now it has been observed that in obesity there is an increase in the gut permeability. There's a disruption of the intestinal barrier, which leads to the passage of components like lipopolysaccharides, which is an endotoxin, and that is kind of released into the systemic circulation. And these levels of lipopolysaccharides, increased levels, they can initiate an inflammatory cascade in the adipose tissue, leading to the production of pro-inflammatory cytokines and also inducing neuroinflammations. So humans with obesity, they have been found to have a significant higher level of LPS particularly after a high fat meal compared with lean controls. Now, if we look at the role of gut microbiota in relation to the other neurotransmitters, it has been seen that it's associated with a dysregulated dopaminergic transmission. Again, the entire pathway getting activated there, the motivation reward pathway, the entire pathway that we were just speaking about some minutes back, the homeostatic pathway, the hedonic pathway, all of it getting activated with the dopaminergic transmission because of the dopaminergic transmission. Also, the plasma serotonin levels have been found to be raised in individuals with obesity, and that has also been found to be related to the alteration of the gut microbiota that would have an effect in the increased energy expenditure and protection against, we've understood this, that, inhibition of serotonin is basically good for if decrease in obesity, and increase in the serotonin levels would have a role to play in the alteration of the pathways and leading to increased fat accumulation and thereby, obesity. We've also understood about the role of GABA in its control of the hypothalamic control of food intake. Again, GABA can be stimulated by the bacteria of the microbiota like bifidobacterium and lactobacillus and their proportions in the body. So there have been a lot of studies done with fecal microbiota transplantation from lean donors, and we've understood, though they've not come across very strongly as treatment options as of now, we've understood about the role that GABA has to play when you're looking at the FMT and from the lean donors in the obese donors, and seeing the difference in the levels of the GABA that is present in these two sections. Also, the small chain fatty acids, these have also been found to have a role in the obesity circle, you could say. So the acetate and the butyrate propionate, these are basically organic compounds which are produced from dietary fibers, and they're metabolized by these specific bacteria found in the intestinal tract. So lactate, butyrate, propionate, acetate, succinate, these have important functions in the gut-brain axis. So they act as chemical messengers, and they basically signaling, and they act on the pro-glucagon and the pro-PYY gene expression, thereby having an increase in the GLP-1 and PYY levels, and so either inhibiting the ghrelin secretion or regulating the appetite by releasing it into circulation. So there's actually so much more. I mean, there's so much of contribution from the gut, as you can see, from the various aspects, be it EEC or the small chain fatty acid or lipopolysaccharide or the vagal or the various gut hormones. And all of this basically, you can see they are interrelated, because these small chain fatty acids will have a role in satiety. They have a role in the epigenetic effect. They have a role by directly stimulating the vagal nerve. So they're kind of interacting with each other and having very strong roles to play in obesity. Now, if we just want to understand briefly about the association between the gut microbiota and the gut hormones, are they interconnected? Yes. Bifidobacterium and lactobacillus negatively correlate with ghrelin and positively with leptin. And similarly, the ratio of bacteroids and firmicutes has been associated with a decrease in ghrelin. We can see that thereby that the supplementation with lactobacillus was seen to have an effect on the leptin responsiveness in the high-fat diet mice. And what are the factors that influence these gut microbiota that seem to have such a strong role in obesity? So these effects are, multivariate. You have the diet, you have the medications, there's the geography, the lifestyle, even the process of birth seems to have an effect on the gut microbiota with, the normal delivery children having a better microbiota environment as compared to children who are born from cesarean section. Also, breastfeeding seems to have a positive effect in bring about a eubiotic gut microbiota environment as compared to those who are formula fed. And then, of course, as the child grows, and there are so many factors which contribute to stress and all the other factors put in, they will have a role to play in the ultimate gut microbiome environment that is there in a person, and thereby that will have an effect on the obesity axis. So as you can see there, factors like sleep disturbance and artificial sweeteners and antibiotic treatment, all of this also contributing in various ways, apart from the stress and the genetics and the epigenetics, which are in the total dysbiotic environment of the gut microbiota, and thereby leading to all these other factors causing the metabolic disturbance in the body, the obesity, the dyslipidemia, the inflammation, insulin resistance, and also MFLD. So a healthier profile and an at-risk profile this is again a very, very oversimplified picture, but grossly it's telling us that these are factors that the fat is beyond what is being stored in the adipose tissue. It's also contributing in so many other ways to cause the obesogenic signals and leading on to obesity. And of course, the other factors also: carbohydrate intake, food, the diet, the drugs, surgery, etc. So high fat diet, just a small diagram to tell us about how a high fat diet leads to a leaky gut, and then the next pathways thereby follow downstream. Do the lifestyle factors have a role to play? I mean, something like breastfeeding, as I was just saying, would affect the diversity of the gut microbiota and protect against overweight later on. Antibiotic use, a lot of antibiotic use, particularly in children, that again would affect the microbiota and then lead to a risk of obesity later on. Sleep disturbances, very common in our society today, also leading to the alteration in the tight junction proteins and again increased intestinal permeability. So these are the metabolic implications, and there have been studies which have been done to look at the gut microbiota and the metabolic health amongst the overweight and the obese individuals. So this was a particular study which was published in 2020, and they kind of compared the metabolically healthy group with the metabolically unhealthy group. And this was what was seen: the fusobacterium was more abundant in the metabolically unhealthy group, with a lower abundance of some other types of bacteria that have been mentioned here. So there was an alteration in the gut microbiota composition, with significant differences in the composition of the gut microbiota between the unhealthy group and the metabolically healthy group. So this again telling us not only about the metabolic diseases, but you can see also implications in terms of Parkinson's disease, Alzheimer's, thyroid, sarcopenia, rheumatoid arthritis, and also the inflammatory bowel disease. So basically a component. This is what we've understood if we just place it in one frame, that an unhealthy diet, microbiota changes, gut immune imbalance, leaky gut, dysmetabolism, translocation of bacterial products, low-grade inflammation setting in and leading to the entire environment of insulin resistance, dyslipidemia, and islet cell damage. So these are certain weight loss biomarkers that have been studied. They have not come across very strongly, and a lot of studies going on in this area actually. But they've basically tried to understand that, okay, if you look at the profile, can you predict which patient is going to respond to maybe lifestyle or respond to a particular molecule if you look at the gut microbiota? And that's a very interesting area of study there. We do not know a lot about it right now, but yes, studies are on to understand. So again, the obesity biomarkers, this is one particular protein that was studied, zonulin, to predict inflammation. Now, it would be really good if we could actually identify a biomarker which would help us understand whether or not a patient is going to respond to, your lifestyle changes or the molecule that you're going to put in. So these are studies that have been done with zonulin, and they did see that in patients who were leaner, the fecal zonulin was lesser, and as the patient went on to become more obese, the fecal zonulin levels were more. So you could maybe predict whether a person is going to go on to become obese if it's there in the family. Maybe the particular person is lean now. You could look at the fecal zonulin and predict things. So it's parallel, and it's lowest in normal weight and highest in individuals with obesity. Again, biomarkers for the assessment of permeability. Can you understand what's going on inside your body by looking at blood levels? So lactulose mannitol ratio was determined, and it was seen that it could be seen as a marker of intestinal permeability. So again, as you went across, you could see that the levels had were increased in patients who had increased intestinal permeability. So today, when we have understood so much about the gut, obesity axis, the gut-brain axis, and its role in obesity, so have we been able to harness it to modulate the axis? And can you do anything to, basically bring about changes in the gut microbiota so as to bring about a change from the dysbiotic to the eubiotic environment? So a lot of therapeutic approaches are being looked into: the prebiotics, the probiotics, the symbiotics, the fecal transplantation. But till now, though theoretically we have a lot of reasons why prebiotic or probiotic supplementation should help. So as you can see, the various pathways and improvement in these, and thereby the reduction. The number of studies that have been done, and most of them have been mice model studies and others, some have seen some amount of improvement in terms of reduction in fat content, or reduction in improvement in the lipid profile, or the energy metabolism, or the overall assessment of the total amount of fat. But till now, results in human trials have shown that there's a reduction in metabolic endotoxemia, and in terms of small chain fatty acids, there have been changes. But in terms of trials looking at the effect of prebiotics on weight loss, results have not been very good till now. You would expect that you're putting in an inulin type fructans, and you would expect to see an improvement in the GLP-1 and PYY with the concomitant downstream pathway effects. But that, unfortunately, till now has not shown results. Maybe in the near future we might be able to see some results. So in conclusion, what is our take home? It's a lot, and the take home, I really did not put in sentences, because I just thought I'll just put in one particular picture, because it is such a complex picture. There are so many aspects of this gut brain axis. There are so many people, or so many not people, there are so many factors which are talking to each other: the metabolites, the hormones, the LPS, the leaky gut, the vagal nerve, the GLP-1, the PYY, the cytokines. So all of it put together, it's a complex environment. It is so much beyond what we had known earlier. And as we come to know more and more about it, we are really understanding how this kind of this environment, this gut and the brain, they're constantly talking to each other. They're constantly, muttering amongst themselves. Sometimes the muttering is good, sometimes it's not that good. As we started off with the line on the couples, apparently these people are this section of your body is talking much more than you can ever imagine. But to bring about a positive kind of muttering and not a negative kind of muttering would require a lot of changes in what is kind of affecting this entire environment. And probably in the next few years, as we come to understand more and more about this, we might be able to harness this to bring about changes in the entire axis of obesity. And on that note, thank you so much. I'll be happy to take any questions if there are any.
Thank you, Dr. Dasgupta, for a wonderful presentation, short and to the point. We would like to open our question answers. Dr. Chong.
Thank you, Dr. Dasgupta, for that wonderful little dissection of a very, very complex topic. I just want to ask you practically, what can I do for my patients in my clinic? Honestly, sorry to ask such a tough question.
So basically, I think when we looked into the factors that affect the gut microbiota or the gut hormones, we've realized that significantly lifestyle changes, but the changes have to start from the very beginning. I mean, you can see there that it starts right from birth. And it has been seen that, kids who are exposed to the environment in comparison of, the birth process, so the breastfeeding, the environment the child is exposed to, and subsequently as you grow up, all these factors that we've known, the high fat diet, the junk. So it's just beyond our understanding of the fact that it is much beyond the calorie intake and the calorie out is what is going to help us direct our patients, I think, or the society at large, about what needs to be changed. So I think what we can do for our patients is not in terms of prebiotics or probiotics, but basically we could bring about changes that kind of affect this entire environment. When we looked at that particular slide, which spoke about stress and lifestyle and food and high fatty diet and high carbohydrate diet, all of which have an implication on the gut-brain axis, there is, I think, where we could make changes as of now till we get something better.
Thank you. And what is your thinking when we prescribe antibiotics for our patients, for all kinds of infections? We're very pragmatic when we treat infections. In fact, like for myself, I think infectious disease is probably a huge chunk of my practice, although I'm not an ID physician. What are your thoughts when we think about prescribing antibiotics?
So obviously, when antibiotics are needed, we'll have to prescribe them. But say, for instance, in our country, over-the-counter antibiotics are available, and there's a huge misuse of antibiotics. We do realize that people start off with antibiotics, they do not complete their courses, or somebody is given them for 2 to 3 days, and the symptoms subside, and they stop the antibiotic courses. And so all of this really needs to be spoken. The antibiotic stewardship, as it is called, it really needs to be brought about in a proper manner, because we can see, apart from resistance and all other things, what kind of effect it is having in the totality of the gut environment as we looked at it today, and of course the other environments also. So certainly the practice of using antibiotics in a coordinated and a regulated manner has to be brought about by the entire medical fraternity. And of course, the over-the-counter sale of antibiotics, it really needs to stop, because I think we face a huge problem here because of that.
Thank you, Dr. Dasgupta. Angelique, you have a question?
Yeah, thank you so much. It's a very interesting presentation. I still have to digest some of this, but I will go and watch the video. But just a few comments. The one was regarding to what Dr. Chong just said. I've been trained that an antibiotic like ciprofloxacin, if you use that, it actually kick out your gut bacteria for at least 8 months after you have taken one course of that antibiotic, and it's quite frequently being prescribed for lower tract infections like urinary tract infections and all of that. So I think we as doctors also need to understand, if you look at the antibiotics, what is the effect of that specific antibiotic on your gut biome, and so that it also guides us and that we make better choices when prescribing antibiotics in future for our patients. But I want to come back to the high saturated fatty foods. This must also be, there must be political will as well to bring down or to increase the availability, affordability, that's actually a better term, for more healthy foods. Because as it's currently, it's not only common in South Africa, I've seen it in Pakistan, I think it's across the world. We all have the same problem with obesity. And while these high fatty type of foods are allowed, and it's cheaper than the healthy foods, we're never going to win this battle. It must be the other way around. And again, for that to happen, there must be education as well as political will to change this environment. This is a global phenomenon. I've seen that recently, obesity is now a chronic disease. And you can already see the young babies coming in your surgery and this baby is going to have a problem one day, but the mother doesn't see. And again, there's not enough information and to the lay people out there, and even the doctors doesn't always understand this. Thank you.
Absolutely, ma'am. Absolutely.
Hello. Yeah, I'm Dr. Manisha here. On a lighter vein, you might have heard Punjabis or other, especially North Indians say, "Mere sir te gas chad rahi hai." Every time there was gas in the abdomen, it went up to the head, and we used to laugh as medical students. But now hearing you, I mean, it seems that there is a connection. There is a connection.
Indeed, the gas goes way beyond the abdomen, and it really affects so many areas of the brains. Yes.
Yes,
indeed.
yes. Yes, and you found the connect. And
Can I ask
our
question?
ancient wisdom did have a lot to say about gut and paid very high regard to gut cleanliness, gut role on the body, obesity, everything. Because I'm a student of yoga and even Ayurveda, even as an MBBS. So I was always puzzled why so much import to gut. Thank you.
Can I ask question?
Yeah, sure.
Oh, thank you so much. Dr. Dasgupta, thank you very much. Very nice and presentation and very descriptive and you completed in 30 minutes more than this. I have one question. That the microbiota you told no doubt change. There are so many factors. Uh, you also discussed one of the factor was the antibiotic. Let me know what are the list as I am basically pathologist. When I was looking the list of these microbiota, we know there are in our gut there is anaerobic bacteria, but in the list there were so many aerobic bacteria which were there. So I was strained how they can live in the gut because they need the oxygen and something else.
Okay. So I'm really not aware about how this
Streptococci and so many other, these are aerobics.
Yes.
And these are aerobics. No doubt these are the pathogens. And while they are in our gut, they are anaerobic because when the person die, they decay our system and something else. But in microbiota, due to some factors, you have made a list of these uh, uh, the bacteria, and most of these bacteria are aerobics, and they need oxygen. No doubt we know that there's the use of antibiotic and other things. Our microbiota has changed. But in the list, I was trained. Maybe change, there is some other their habit. They may become habitual of the gut or something else. If you know something about this.
I really will have to look into this. What I basically found as I was going through the data on this was that, particularly if we oversimplified, then they said that the firmicutes increased in a dysbiotic environment. The bacteroids basically were decreased, and the acinobacteria, they said that it increased in the obesogenic environment.
Yes,
And then they
yes.
also spoke about the verrucomicrobiota, which they said was decreased. So how and why? I think we'll have to go a little deeper, sir, to
Okay.
understand why this
So
happens.
my another
Why is it
question
that
is,
this particular strain increases and the other
thank
decreases?
yes, thank you. No doubt, the brain is have very good connection with the our gut. Our gut is next brain. You know, the maximum after neurons after brain are present in the gut. Sometimes it become autonomous. It decides without thinking about this to gut it. Like increase of appetite is sometime in the obesity is not with the brain autonomous. And you mentioned the prebiotic. What are the role of this in decreasing the this changing the probiotics in the gut?
So when we looked into the prebiotics, basically these were the selectively fermented ingredients, which resulted in a kind of change in the composition or the activity of the gastrointestinal microbiota, and that is how they are supposed to confer the benefits. So there were trials which were done with prebiotics, and then it was shown that generally there was a reduction in the endotoxemia, and there was an increase in the small chain fatty acid production in patients with obesity. So when they put in like inulin type fructans, and then they showed that the growth of the beneficial lactobacilli or the bifidobacteria was seen, and there was also seen to they were also seen to show an increase in the GLP-1 and the PYY response. So thereby that could have an effect on the ghrelin. That is what the entire concept of introducing prebiotics in this particular cohort was about, because they said that it is going to positively alter the gastrointestinal microbiota. That is what the role of prebiotics is said to be, sir.
Thank you very much once again. Your lecture has decreased my appetite, and I am skipping my breakfast. Thank you, sir.
Thank you, sir.
One of the questions says that I feel hungry even after eating full meal. How does the gut-brain axis explain this? The second is, does late dinners, irregular eating, uh, does it affect the gut and brain system healthy?
Yeah. So
I think
first thing is when a person says that, I'm eating a lot and yet I'm feeling hungry, that would have a very strong implication on what the hypothalamic area of that particular person is behaving like. As we saw, that it is not only the, your abdominal fullness or your actually you're done, but your that is the eating for hunger. Your homeostatic part of the brain is saying that I'm done. But the hedonic part of your brain, which is eating for pleasure, so you've had a full meal and then you see that pastry there, and you know that you don't want it in terms of what you should be eating. You're not hungry, but you're eating for pleasure. So that is the hedonic part of your brain. And as we talk about the hedonic part of the brain, we know that we just saw in our slides that the gut hormones, the gut microbiota, the vagal signaling, all of it has a role to play in what you're eating for pleasure, apart from what you're eating for hunger. So yes, indeed, the gut axis does have a role to play in this factor, that you don't actually need the food, but in spite of that, you're eating again and you're going back to the fridge, taking out something and having it. We often do that. So that is because of the hedonic part dominating over the homeostatic part of the brain. And yes, gut axis has a strong role to play there. And the second question, I'm sorry, what was the second question?
Unhealthy meal affecting your
Oh,
system.
yeah. So they asked that, okay, if you're eating late night at night or you're not sleeping well, yes, we did see that sleep disturbances have a role to play in the alteration of the gut environment. Yes, it does. So it's not only what the sleep is doing in terms of the increase in the cortisol or the increase in the other, obesogenic hormones, but it's also about what it is doing to the gut as we understand it today. So that will again lead to the alteration of the axis. Yes. So sleep disturbances per se, I do not know about late meals because I did not read anything in particular about late meals, but sleep, deprivation of sleep, alteration of the sleep cycle, this definitely has a role to play in the gut brain axis.
Thank you so much again. Sorry to come back to with another question. If I'm a mother, what advice would you have for a mother have limited money, standing in a shop, needs to buy food for her children, keeping in mind, for breakfast, I need to get something for my children that would actually improve their gut health, lessen their hedonic thoughts about seeing food that would make them eat more. What would you advise that mother? What should she look for? Should she look for yogurt, for example? What should she look for to make sure that at least one meal a day would be
So
great?
per se, though, we have spoken about yogurt and the role it has to play in terms of being a probiotic prebiotic composition. Unfortunately, the results have not really translated that much, but yes, definitely as a part of the meal. If what would she look for? She would want to avoid the high fat content, so not given something that has a very high fat content. Kind of coordinate the amount of carbohydrate that is being taken, and so not, in our country we have a lot of carbohydrate being supplied in every meal, which is not true across the West, I guess. But yes, the carbohydrate content, there needs to be a lot of vegetables, and as we know, basically avoid the kind of junk food. And yogurt, yes, it would bring about a positive change. Unfortunately, we haven't seen great results with yogurt and others that have been supplied, through the food, in terms of the alteration of what has been seen in terms of the maybe the dopaminergic or the serotonergic. These were studies that I looked into with the use of yogurt. Not great changes, but yes, definitely a positive change. So instead of the high fat food, if the child is getting yogurt, is getting fruits, is getting vegetables, a moderate amount of carbohydrate, and completely cutting out on the high fatty food, I think that would help in starting off a proper environment from the very beginning as the child is growing up.
Thank you. Any other questions on the floor? Session. and it's a very important. We would also invite the speaker. Yeah, please go ahead.
Sorry, I just didn't get you. I couldn't hear you. Was there a question there?
No, it wasn't a question. I'm asking if anybody else has a question. Otherwise, we can wind up the session.
Right.
Dr. Chong, I think we can wind up the session if there's no more questions.
Thank you, Dr. Dasgupta. Was wonderful, introduction to a very interesting, but yet I think still a lot of things to be decided in this area. We'll love to figure out. I understand there's a human BioMe project ongoing right now, and we hope to hear more from that project. This is a very interesting area. Again, I think a lot of things are happening in this area, so we look forward to seeing more.
Dr. Chong, I would like to add something which I have learned over the last 1 week, 1 month, and I think since Dr. Dasgupta, again, it is related to the diet and everything. So, I was following something related to natural medicine, and so what they said that if you eat late, your body needs to rest, your body needs to breathe. There's a certain number of hours you can spend on your including your body organs which are working. So like if you eat at 7 o'clock, it takes 7 hours to eat, digest. So in the morning, it's very important when you drink water, you are helping your digestive system to clean your body. If in the morning, first thing you start eating food instead of let's say if you get up in the morning, you had a heavy meal at 10 o'clock in the morning, 8 o'clock you have a breakfast. So your body has not given enough cleaning time for your gut, or so what happens is when you get up in the morning, how important is to drink water, how important is to give the intermittent fasting, how important is to relax your gut for your brain, that it gives enough time to clean the body. So a lot of times when you have an inflammation in the body, a lot of times if you have issues related to your gut, it is also your natural diet what you're following. Is that something you want to put on?
So water as a therapeutic intervention is a very, very interesting area. Maybe someday we could talk on that also. Yeah. So yes, indeed. I mean, we have known all along, and I think even our ancient books have spoken about this, that you do not start off the day with that heavy sugar coated tea and the maida and the biscuits and we wouldn't want that, right? So definitely yes, that sounds very, very scientific. However, exactly what is the scientific basis of what they're saying is something we'll need to look into. But yes, that sounds very. I mean, it sounds very, very, very feasible, and it is something that can be done so very easily. So yes, if you're saying that water initially does help, we'll need to look into the scientific basis of this. But it sounds quite correct.
Thank you. So yes, as I was saying, I think this is a very interesting area. A lot more to be said and done in this area. So we look forward to getting an update for you in the future, Dr. Dasgupta, on this matter. I'm sure you're tracking this whole area as it moves and evolves. So thank you again for today's wonderful presentation. We really had opened our eyes to this whole area, which is a bit shrouded in mystery at this point in time. Thank you so much.
Thank you so much, sir. Thank you.
Thank you.
So thank you everyone for joining in.